Greetings from the European Health Forum Gastein. Despite robust evidence that investing in health generates long-term benefits, including economic growth and more productive societies, economic and demographic pressures have EU member states targeting healthcare budgets to address public funding shortfalls. I'm Duane Schultes, and on this Vital Health podcast, we'll investigate how improved budgeting models and investment metrics could deliver both improved outcomes and healthier societies. And I'm very pleased to be joined by three excellent speakers today. Firstly, we're joined by Dennis Ostwald, the CEO of the WifOR Institute. Hello, Dennis. How are you doing?
Very good, thank you.
Thank you for joining us. We're also joined by Massimo Bordignon, Professor of Public Economics at Catholic University of Milan and a member of the European Fiscal Board. Massimo, thanks for joining us, sir.
You're very welcome.
And we're also joined by Herwig Ostermann, the Executive Director of the Austrian National Public Health Institute. Hello, Herwig. How are you, sir?
Hello. Hi.
So, Dennis, let me begin with you. How can investing in healthcare contribute to a well-being economy? What do we mean by that?
Thank you so much for this question, for this warm-up question. I really like the expression well-being economy, because we often talk about health economy, and well-being economy it's much more tangible, because we need to see health not as a cost but as an investment, and an investment in better health and in prosperity of countries. So we are doing calculations since 15 years on behalf of the German Ministry of Economic Affairs around the impact of health investments on the German GDP. And just as an example, 12% of the German wealth, the GDP, is related to health investments. Close to 17% of all employees in Germany are working in the health economy. 8% of all exports are related to health investment. But this, and that's why I love the expression well-being, that's only the economic point of view. If you think about the better health due to health investments, you need to measure and find out how health investment creates well-being in the societies. And if you see it on a European level, the economic part is close to 10% of our wealth. Right, 10% of the European GDP is related to health investments. But we see very different investment strategies in the EU member states. And there is a high heterogeneity between the countries. And this is something we need to discuss, in my opinion.
And what is the driver of that heterogeneity? Is it economic impact of the sector itself locally, or is it just budgeting decisions? Is it philosophy? How do you see this working?
Honestly, good question. I don't have a clear answer to it. Often it's, I would think, budget topics and prioritization of the countries. So we see countries, Eastern countries, who are investing 5 to 6% of their wealth in health. And we see industry countries who are investing more than 10 or 11% of their wealth in health. So I would see in the long run, but I don't want to say that every country needs to invest 10 or 12%, because you need to see how efficient you invest. You need to invest smart, right, and not wasting money. That's a clear aspect as well.
Well, Herwig, I mean, you are the Executive Director of the Public Health Institute. You're in charge with not wasting money and being, quote unquote, smart with money and health. How do you typically allocate budget? How does it work practically here in Austria?
I mean, basically, budget allocation is always a tricky thing. It's a tricky thing amongst health systems. You have various actors. For the Austrian case, you have federal governments, you have regional governments, you have sickness funds, and they all come up with their individual decisions. So what we basically do in our health reform approaches, and this is not very unique for Austria, I guess, is actually that we come across with these second best solutions in a way that we bring all the various actors together and try, to also bind them to some extent to contracts and to agreements and to share some common goals. But the basic thing is, and I think this is something one really has to stress when thinking about health budgeting. First, do we really think about public health budgeting or budgeting for a well-being society, or do we think of how to finance the healthcare sector, focusing on curative care, basically. I think this is one decision. And when it comes at least to the negotiations on the Austrian national level, usually it is the health sector that negotiates with the Ministry of Finance in order to have sufficient funding for healthcare, basically. And what we do not do currently is actually joining our forces together and bringing all the different areas of different policies in, because what we really think and what we saw throughout the pandemic is actually that it's not only about health in all policies, it's about health for all policies. Also asking the question how actually other policy areas can benefit from healthcare in a way. This was something I think Dennis really elaborated quite well upon.
So when you get the budget, is it an annual budget? Is it a 5-year budget? I mean, how does it work? Are you negotiating for an entire budget cycle of the government, or are you stuck to sort of like the sick funds and an annual by annual usage limit? How does it actually work?
For my country, we do have the privilege actually that we contract for usually it's a 4-time period, financing period, which is actually based on some kind of fiscal equalization mechanism between the federal government and the regional governments. And we also bring in the sickness fund. So basically our healthcare financing is set for 4 years, and it often happens actually that this is prolonged after a certain time because it takes a huge effort to negotiate the whole fiscal equalization again. But the thing is actually that we only discuss fiscal allocation in the specific sectors, and there is no actually mechanism that brings in the other policy areas that are relevant. And I think this is something we are really missing. And what we are also missing to some extent, is actually asking the question, to what purpose do we do this kind of exercise? And first of all, we know it's about healthcare and providing healthcare to the people in a proper way, ensuring quality, ensuring access. But it's more of that. It's actually, asking the question, how can we, in a long-term perspective, for instance, also improve in terms of sustainable development goals? How can we improve as a society as a whole? And these questions are then even more long-term than these 4 or 5 year periods. It's about, the purpose of our public good in a way. And this is something which is interesting, actually, when you take a look at those countries where we think a well-being economy is high on the agenda. This is, for instance, Finland. Yeah. This is Iceland. This is Wales. This is Scotland. And actually, they came up with this notion of well-being economy after the fiscal crisis in 2008. So once you have this very, very intense effects, actually, where you see that the current mode of operation is not feasible anymore, then actually societies and also the state poses the question. And for instance, if you take this Wales initiative, I mean, it started with the big participatory process in a way that Wales ask, what Wales do we want? And I think we should also ask, what Austria do we want? We should ask, what Europe do we want? We should ask, what kind of society do we want?
I'd like to bring in Massimo now. Now, Massimo, we've had a couple, interesting already points about how we need to look at this more holistically as well as on a different time horizon. Practically within the confines of the EU budgeting structure, what do we need to do to shift the mentality to see health as not a cost rather than an investment? What do we need to do, Massimo, to sort of fix this?
Well, first of all, thank you very much for the invitation. Well, I think we need to do a lot of things which go in the direction that we have said, that my previous speaker has said. But I think there are some things which have been done, which I think we have to exploit more. That's also the reason why, in a sense, I'm here. And I'm talking particularly of this new economic framework for the European Union, which is basically the reform of the fiscal rule. And the important thing about this reform of the fiscal rule is that for the first time we move to a really multi-year budgeting. Because so far the European fiscal rule really were based year by year. I mean, right. It was this kind for a number of countries, particularly countries like Italy, which are heavily constrained. The point was very much you can spend the next year. Now you have a plan, and you can, as assumed, I mean, you have to control spending for a period up to 7 years. And what you can do, you can then spend a bit more in 1 year if you prove, you can show that this means spending a bit less in the next year, or having higher growth in the next year. And this is an implicit notion investment, which goes beyond the accounting notion investment. Because when you talk about healthcare, most of the spending is actually current spending.
Right.
And I think that this is the way in which, in a sense, of course, you have to prove that this spending is actually, this higher spending, for example, preventing care today is going to bring benefits for the future. That's, for example, an exercise that we did together with Newhouse, New Europe, Ambrosetti, for the future, what will be the interventions on preventing care. The point is that you have to provide this kind of simulation reference, even to make the Minister of Health, talking with the Minister of Finance, because otherwise the Minister of Finance is so much pressed by constraint, many demand, whatever, that then at the end it starts to be you make problem to make long-term program, you make problem to have general discussion where you want to go, and so on and so forth. So what I wanted to say is that there is an opportunity. It's not the only thing that the European Union could do, but at least there is an opportunity that people have to be aware of and that have to be, in a sense, exploited even this context.
It's a bit odd to me that if you build a hospital, for example, nobody's looking at financing the hospital or developing that infrastructure on a 1 to 4 year budget. That's a 10, 20-year investment. We're here in Gastein, they're rebuilding the large viaduct bridge for the rail train that goes through the valley. I'm sure that's not on a 2 or 4 year budget. What do we need to do practically to adopt these practices in healthcare that other sectors are doing? Herwig, I'll start with you. How do we deal with that more practically? What's the barrier to doing this more intelligently and long-term and seeing this more as just a practical investment?
I think the difficult thing is basically that we often think of healthcare budgeting as a national agenda. And we do still have differences in our public health systems throughout Europe, and we usually see healthcare or providing healthcare as a national agenda. And here in Gastein, I think we've been talking about the European Health Union for decades now. And if you bring in this example with the railways, there is a European framework plan. And actually, Austria is doing this because budget has been allocated, but it's also some kind of European obligation, to have all the networks working together. And healthcare is very much also linked to a European agenda. What we are somehow missing is, this common idea on actually what would be an appropriate spending for healthcare. We should have a dialogue on what kind of basic healthcare services we have to provide in all our countries. We should think about a common European health, not only data space, but also when it comes to providing, new technologies, access to medicines, and all of that. So I really think that this is the way forward, and what we see in member states, and this is something I think which is also very important. If you take the timeline for the last 2 or 3 decades, actually, much of governmental innovation came in throughout the European or from the European dialogue and was also imposed on the basis of European legislation.
Denny, picking back with you, how do we make this not a zero-sum game as we're hearing from Herwig here? How do we adopt some of these practices?
I think if you measure it, you can shape it. It's really a question of measurement. Thank you for your advice concerning not health in all policies, but health for all policies. That means we need to think out of the health bubble and provide evidence to other policy areas which they understand. And they don't care about a cost-effectiveness study. They don't care about health outcomes in a way. They are P&L guys, right? or they are dealing with other topics. So you need to provide a matrix which is understandable for more stakeholder. And there is a suggestion, a very simple one, we created together with Rifat Atun from Harvard University. We suggest 3 layers. First, the economic impact of health investment was what I described before. Like every other sector, if you invest in a bridge, then you do know how much jobs you are creating, how much GDP you are creating, and these are arguments the ministers of finance know about. And this, if you build a hospital, you have an economic footprint every single year, right? And you can measure it in GDP categories and employment numbers. Second, you need to measure the impact on human capacity, because no other sector worldwide creates better health. And in a macroeconomic point of view, you can measure the impact on productivity and also on unpaid work. So, because you shouldn't forget about elderly people who are retired, but also doing very, very valuable jobs for the society. So you need to measure these effects. What creates better? What are the effects of better health in terms of productivity and well-being in the society? And the third is we need to think, and this is something I get furious about. We are always talking about costs and we need to do cost containment. I wouldn't say that healthcare systems are the cost factor. The diseases are the cost. We can't afford the diseases anymore. We need to get rid of the thought of the repair shop. We need to think about well-being. How can we prevent? How can we create better, healthier people in our countries? Therefore, the third layer is the reduction of the socioeconomic burden of different disease areas. And we need to tackle these disease areas. As an example, cardiovascular diseases create a societal damage to Europe, which is equivalent to 4 up to 5% points of our wealth. So we need to start to fight against cardiovascular diseases. And if we prevent 1/3 of them, then we create 1.5 percent points more GDP or more productivity for our societies. So this is the way we need to think. And once again, if you measure it, you can shape it. Massimo, thank you for your comment. Yes, the EU embedded the MFF, right? A health fund for the period 2021 to 2027. I would suggest that we should now evaluate the effect of the first 3 years. What is the impact of the 2 billion, I think it's the volume per year? What is the return on this investment in the well-being economy?
That's a great point. Massimo, are there any plans to do a midpoint analysis here and do an impact assessment? What are the next steps there?
Well, I mean, my own work was more a suggestion to try to shape the discussion here in Italy, since they are now preparing this plan and see whatever. I'm not, unfortunately, involved directly in government, so I don't know if they hear me or not. I have an idea how you can produce it. Of course, in the kind of exercise that we had done, thank you very much for your comments before, because this is actually what we try to do. I mean, we try to use a different kind of analysis of potential benefit. The point is measuring, but of course measuring is always come up with some uncertainty, but you can try to do the best that you can. And then we have a different kind of period. What would happen in 3 years? What would happen in 7 years? What will happen in the long period? Try and calculating a benefits to cost ratio, where the benefits were, discounted the difference using the Italian cost of debt, which is the highest in Europe. So if it works in Italy, it should work even more generally, in Europe. And, this is the kind of argument discussion that we need to insert in the discussion, because I completely agree with what I said before, that health, is even investment for all the reasons we say. It's not just a matter, the disease is the cost we have to try to avoid, because there will be enormous benefit, even particularly for an aging society like Europe. Let me go back, if I can.
Please, by all means.
The point which was raised before about this European health, we need a health union. I think I couldn't not agree more on that, because what we have really seen that during the pandemic, the Commission start doing things which were not actually in their competence. I mean, all the purchasing of vaccine and whatever, the distribution across the country, whatever. And, because there was an emergency and we decided to keep even Europe together, we had to do this step, even if it was beyond what the kind of competence we are given to the European Union. And I think we have to start thinking. I mean, in a report that I wrote a couple of years ago for the European Parliament, we estimated would be the effect of moving at the European level, some kind of regulation, procurement of some specific issue, not everything. And it turned out that there could have been also a very quite large saving. And for a country like us, I mean, in general for the European Union, we are going to be very heavily pressed in the future on fiscal constraint, not only Italy, but basically all Europe, this is a very important message. So, of course, there is a lot of heterogeneity across country, and you don't think that healthcare has to be moved all at the European level. But there are specific issues in which we could really save money. There is a cost on Europe here.
Well, Massimo, you've really hit a button here with Herwig, putting Austria in the context of the European Health Union. Like Massimo saying, look, we need to do this more to our competency across all of Europe and not just outsourcing it to folks when there's an emergency. What's your opinion?
Yeah, no, absolutely. I couldn't agree more again. I mean, the thing is, basically it's about capacity building. And for Austria, it's a rather small European Union member state, If we're doing all these things alone, if we purchase our own medicines, if we purchase our vaccines, if we deal with big industry in a way, but also, when it comes to expertise in terms of budget allocation, when it comes to expertise and knowledge sharing in innovation in healthcare, for instance, when it comes to expertise in public health and prevention, and everybody, is doing it on an own national basis. We do have our platforms for exchange, but actually, what then is a bit sad, we have to balance a double agenda. Yeah. There's public health and healthcare on the one hand, and then we have a well-being economy or a well-being society. And also when it comes to metrics, it's about capacity building, understanding what metrics are relevant for people working in other policy areas and bringing those together once again. So here, actually, what we felt during the pandemic was at least a huge event where Europe was forced actually to pool its capacity from various member states, and to my impression at least, this really worked out at that time.
Denny, you quoted one of my favorite quotes of all time by William Thompson Kelvin, who said, "What is not defined cannot be measured. What is not measured cannot be improved. What is not improved is always degraded." I think that's a really fabulous quote. Massimo, related to that, you've been talking about, look, we need to measure, we need to look at outcomes. If I think about AMR, antimicrobial resistance in Europe, the ability to actually utilize a cross-referencing data set of EHR data, first off, can you do it under the GDPR? I don't know. Probably not. And then the second thing, to have the technical expertise to be able to join enough EHR systems to get a proper costing of this to see what's really happening from an investment standpoint. Should we be investing more in AMR? That's a really difficult problem that combines technology, it combines privacy, and it combines political will to be able to do this and investing in IT. How do you fix those barriers? How do you deal with that?
I think it's a good one. If you get a mindset that health is investment and investment in health creates a return on investment, it's always a question who finances it, right? Who is investing in health actually? Is it public or private or whoever, right? And also to tackle AMR, I think there are a couple of ideas how to finance it. First, maybe we need to shift budgets within healthcare systems. We need to start a discussion. Is it smarter to invest in a hospital or in R&D or whatever? Hard question. Second, we need to convince in some countries ministers of finance to maybe allocate more budgets from other resource, from other budgets to health. Third, now it's getting a little bit more interesting, including development banks, right? The European Investment Bank. Why shouldn't they co-fund ideas around AMR? Then something what would be the future kind of. Maybe we can find private and public finance white bonds for AMR as a finance instrument. And last but not least, that will, because Massimo mentions high constraints due to high debts in Europe, I would wonder if not rating agencies should upgrade countries who are investing smart in health, because in my opinion, they don't take enough into account the well-being economy sorts of the countries. So if we have seen during the pandemic crisis that countries who are underinvested in health suffered much more, also in economic terms, and that's the way I think, my understanding is how rating agencies should act and think about the fact if Italy would invest even smarter in health, and they would get an upgrade in their ranking, rating, then they could refinance their debts more easily with lower interest rates. And that would be a huge game changer, in my opinion, of fostering a European idea about a healthier society in Europe. And yes, AMR will be, some of the experts mentioned that it can be getting the next pandemic crisis, right?
Yeah. So Massimo, talking about AMR here, what about something like oncology, which is even more difficult? I mean, what do we need to do practically? What needs to happen from an infrastructure in Italy to be able to do something like this along something far more challenging with segmented oncology? How could you practically do that?
Well, I mean, we are already doing it. I mean, it's not the health. I mean, there is a lot of difference from the north to the south of the country, but in general, particularly talking about hospital, the quality of healthcare, particularly oncology in Italy, I would say that is pretty good. The real problem that we have now is that we have invested, in a sense, too much on the hospital, no? Because that was, in a sense, the higher level and where we could reach, too little in all the kind of things you could do, particularly with the new technology at the local level, at the territorial level. So in a sense, we have, in my view, we have distorted, in a sense, the spending toward too much hospital, too less. And we have paid the cost for that during the pandemic. I mean, for example, Lombardia, where I live, is well known to have very high level hospital, but very low quality of territorial healthcare. And that has meant that a lot of people, I mean, they had to go to the hospital to be cured for the COVID, and there they died because they got all this kind of thing. So I think there are some serious rethinking which should be done, including, for example, deciding a bit more what should be provided at the public level, at the private level. Going back to what the suggestion was made, yes, I would be very happy, and hopefully at some point rating agencies start thinking in that direction. Unfortunately, my own perception of rating agencies, they very much, I mean, if you leave them alone, they look very much basically only of outstanding debt, and this debt can be paid back. They don't really care much about resilience or other things. Perhaps what we could do through the other tools that you were suggesting, for example, the banking system, the institutional organization which could invest on the healthcare bonds that would help supporting healthcare spending. That could be one way in which you can try to change the way in which all these organizations look at it. But unfortunately, the problem that I have if I go to speak with the Minister of Finance, yes, fine, good, but if I spend this money now, how they are going to treat me on the financial market? Maybe now, thanks to this reform of the European rule, the Commission is going to treat me better, which might also help the financial market to treat me better. So, is this kind of process that we are discussing.
Do you have the tools now to make a case for prevention being economically viable? Can you make that case now with what you have?
I think that we have made. I mean, of course, actually, we use some example exactly to be as concrete as possible. We use some example in which we had already rough data because there were examples done at the local level in Italy. We use this data. We come up with expectation based on the international literature, the result in Italy. We compute this benefit cost ratio in the very different period, and we come up with a solution and say, oh, look, you are going to save money. Oh, exactly. Not only because you spend less in the future, but also because there is people who is more healthy, doesn't stay at home because of illness and things like that. So, I mean, is this kind of process. And I think that we definitely need to have this kind of dialogue. I mean, with the financial minister, the Minister of Finance, and all the other bodies which are interested in public funding.
Herwig, from your perspective, do you have the tools available to make a prevention case?
I think to some extent, yes. I mean, what we do know from comparative health systems analysis is basically that once health systems shift from hospital-centric care to more primary health care, give up fragmentation in a way, and also have a focus on stronger public health. Actually, this is cost-effective in also economic terms in a way. What was important for the Austrian case, and we had a huge negotiation on our fiscal equalization, where our Minister of Health actually managed to gain an additional budget of I think approximately 1 billion euros annually, which is quite substantial. We have current budget of I think 45 billion, so it's 2.8% of current budget, but still it is annually added to the system. And the argument our Minister of Health was using at that point, and this convinced the Minister of Finance then, was actually, if we do not invest in healthcare, if we do not come up with new primary healthcare centers, if we do not come up with efforts in digitization, if we do not come up in restructuring our hospitals from hospital or from bed-based care to outpatient care, and also invest in outpatient clinics within our hospitals, if we do not that, actually something will happen to the health of the population, and we will no longer be able to serve the population within our healthcare systems, because healthcare systems are not only running scarce on financial resources, we are also running scarce on human resources, and those systems have been under pressure, and I do not see throughout Europe that actually we're back on the level we had prior to the pandemic. So we really have to adopt our systems, and this needs investment.
One final question, and I'll begin with you, Dennis. If you could make one tangible recommendation today, one quick win to promote a well-being economy, where should we start?
Invest in prevention and allocate the investment of prevention concerning the highest socioeconomic burdens in the countries. And in Germany, we started with early diagnostics in cardiovascular diseases. So there are ways to prevent severe illnesses, and this would be so a shift that it's not a repair shop, that we invest in the well-being of the society and focus prevention.
Massimo, same question to you. Quick win, easiest thing you can do from your experience in Italy that could be rolled out across Europe to promote well-being and economic growth. What do you think, sir?
First, look, since I've worked on that a lot, that's also the reason why I'm saying.
That's why you're here, Massimo. So.
We changed it. Look, that there are new European rules. This offer opportunity that there was not there, particularly for investment in social care, particularly for investment in preventive care. Data, simulation, things can be done, have been done by people even much better than me. And this allows you to try to organize better your finances without being too much strict on short-term consideration. That would be my first thing. The second thing, thinking to Europe, I repeat what I said before. I think that this is somehow in the same direction of the Draghi report. I mean, there are some things we had to do together. I mean, of course, there is heterogeneity, lack of faith, whatever, lack of trust, whatever. But obviously, there are a number of things which there is an advantage for everybody if we do together. And stop, and then we will have to find some way to finance this thing together, and including, procurement of some health care machinery and whatever. This is going to be an advantage for everybody. And at the end, we even save money. So, it is a thing which we have started doing during the pandemic. We have to keep doing.
Herwig, what would be the quick win for you?
I think basically that we have to start acting in a way, and there is a sense of emergency, but or urgency, and this sense of urgency can also be supported with mechanisms. And what I really was very fond of was this recovery and resilience facility offered by the European Union during the pandemic. And this was the first financial answer, so to say, towards the pandemic, and which was to me as an observer to some extent also unique and quite opposite to the financial crisis in 2008, when the answer was actually austerity. At that time, the answer of the European Union was to invest in societies. And what was interesting with this program was actually also the time scale. I mean, we had this invitation by the European Union in summer 2021 to come up with programs and to apply for the funding. But ultimately, the programs had to be ready then 3 months after that. And this posed, so to say, a sense of urgency of action to national governments. And for the Austrian case, at least, we were highly successful and gained like 100 million funding for establishing primary healthcare centers, another 50 million funding for community nursing. And this was really, this sense of action. And what we did not do at that time was actually negotiating with healthcare providers, with the regions, and usually having these long-term processes where any kind of interests come in. I mean, this is important and we acknowledge that. But to some extent, talking about things is fine, but you have to get into action, and I think the time is high for that.
Herwig Ostermann, Dennis Ostwald, Massimo Bordignon. Gentlemen, thank you all very much for your time, and it's been really great speaking to you. Have a good afternoon.
Thank you very much. Bye-bye, everybody.
Thank you so much.
Thanks, gentlemen.
Thanks.
The executive producer of the Vital Health podcast is Dwayne Schultes. Our audio editor is Mark Brodeen. Our video editor is Rico Molden. Our project director is Gwen O'Loughlin. This podcast has been made possible with the financial support of Merck, Sharp & Dahm. This Vital Health podcast is a production of Vital Transformation LLC, copyright 2024.